Once you do, search Rainier Avenue Radio. And remember, do not curse out your fellow drivers. This has been your Rainier Avenue Radio traffic update.
Metro League High School football is back.
He tackles off to the races. He could go all the way. He could go touchdown.
The return of Metro League High School football, Friday and Saturday nights on Rainier Avenue Radio.
Makes a stutter step inside, breaks a tackle. He's going to take it all the way. He's going to take it all the way on the sideline.
Exciting Metro League football live on Rainier Avenue Radio. World. It's back.
Women are not an homogenous group.
We face discrimination differently depending on factors such as ethnicity, age, socioeconomic status, and more.
Rainier Avenue Radio is proud to amplify women's voices.
They are the experts of their own lives, initiating conversations within their community about challenges they face, the solutions they're working on, and the opportunities they see.
Please join us this Sunday from 2 to 5 for Women's Voices on Air. We know our challenges. We are the experts of our lives.
We are master multitaskers, prioritizing our family, friends, and our faith above our own needs.
Our needs and voices are too often overlooked.
Please join us this Sunday from 2 to 5 p.m. for Women's Voices on Air.
We tell our stories in our own way.
There is no secret why Downbeat Magazine calls this Seattle's most important annual jazz event. The 33rd annual Earshot Jazz Festival hits Seattle stages October with one-of-a-kind live jazz performances and video live streams all the way through November 7th. This year's Earshot Jazz Festival features established masters like Diane Reeves, Chuco Valdez, Dee Daniel, and red-hot young stars like Theo Croker, Emmanuel Wilkins, and Samara Joy, celebrating both Seattle's history and its future in the world of jazz. Earshot teams up with community partners like Langston, the Royal Room, and Rainier Avenue Radio to showcase Seattle's own resident artists. Tickets and more information are available online at earshot.org. That's earshot.org. Once again, Seattle's most important annual jazz event, I believe. Earshot Jazz Festival, hitting stages early October all the way through November 7th. Call for more information.
This is Paul Pearson, host of Star Time, and when I'm not meeting Mrs. Jones in that cafe for a chat and nothing else, I'm listening to Rainier Avenue Radio.world.
Welcome to Rainier Avenue Radio.world. It's me, your host, Tony B, and this is the impacts of the coronavirus on South Seattle and surrounding communities. We've got a great show for you today, and by that, I mean we have lots of information. Coronavirus continues to be here, and folks are now preparing out to at 2025 at least for this virus and all of the things that this virus brings with it. We have been doing this particular show since March of 2020 when all of this really began, and Seattle was the epicenter, at least that's what they were calling it at the time, of the coronavirus. We've got a number of great shows for you today. Joining me here in a bit is going to be KeAndre Magee. KeAndre had COVID and has a story to tell. So we'll wait for KeAndre to get here, and we'll tell that story. We're also going to be talking with the Director of Workforce Employment for YouthCare. We're going to find out who YouthCare is, what they do, and of course, how the coronavirus impacted the work that they do with youth. Also joining us in the show, coming up here, we're going to be talking about vaccination requirements. All right, vaccination requirements. And we'll be talking about the impact of the coronavirus of COVID on adolescents and children as well. So we have a big show lined up for you here. We're waiting for is KeAndre KeAndre's here. Oh, well, let's bring KeAndre on. KeAndre, how are you?
How you doing, man? I'm doing well. I'm doing well.
Under
Appreciate you having me on.
I'm like I said, we talked about this months ago, and I said, man, I want to bring you on and share your story and have you share your story with us. And so thank you for doing that. Well, let's start with a little background information on you, KeAndre. Tell me, let everyone know a little bit about yourself, who you are, and what you do. Just a little background information.
Yeah, no, absolutely. Well, Tony, I'm born and raised in Seattle, South Seattle. Grew up Rainier Valley area. Played youth football for the Rainier Eagles. Storied organization.
Shout out to Rainier.
Yeah, shout out to Rainier Eagles and all the Rainier Eagles out there, man. Raised by a single mom, youngest of 5. And got to high school and decided, Mom, I want to go to a private high school. Ended up going to O'Day. Graduated from O'Day High School. From there, I went to Arizona State, spent the semester there, and then ended up going to Dixie State University, which is in St. George, Utah.
Okay.
So that's about an hour and a half, to give people some proximity, about an hour and a half north of Vegas. So just to kind of give you where the map where St. George, Utah is at. And actually, for a lot of people who don't know, Corey Dillon went to Dixie State.
Oh, is that right? Before he came to the UW.
Yep. So he went to Dixie State before he ended up at UW. So it was a small world when I went down there. Graduated there, took a year off, and then went to graduate school. Got my master's in counseling. And thankfully, a few months after I finished my master's, I got the job as the dean of students at O'Day High School. And I've been the dean of students for 10 years now. So I got the job when I was 26, and I'm 36 now. So, 10 years later, and I'm here as the dean of students, and I coach freshman football as well.
Well, man, first of all, KeAndre, congratulations to you, my man.
Thank you.
that is worth highlighting, and congratulations to you, and coaching football as well. And as a matter of fact,
hey, none of it could have been done without my wonderful wife, Tony. She's definitely these last, been a pillar, definitely a pillar in helping me get to where I'm at, for sure.
I was also going to add to that you are a family man, 5 kids, 4 girls and a boy as well.
4 girls and a boy. Yes.
All right. I don't know if you see my USC dad shirt.
Yeah. Hey, that's actually my favorite college football team, SC. They struggling right now, but go Trojans, man. Go Trojans.
Hey, I gotta say, fight on. My daughter's going to school there. Well, KeAndre, man, it's been too long since we've caught up, so I had to chat with you a little bit. I want to make sure that we take full advantage of this opportunity to have you on the air and share your story with us. What we were talking about was coronavirus, and as you know, we do a special of shows, and we talked about that. And you began to share your story with me, and I would just like you to tell it going back to where you were when this all started happening. And I'm just going to let you talk here, so take your time and just tell us about your journey.
Yeah. So, just like everybody, what was it, the fall of 2019, we started hearing the rumblings about the coronavirus, probably around November, December. And then it started getting more aggressive. And me being an educator, we were always really keeping an eye on it because of the, how it could potentially impact school. So as it's going on, we're watching it and trying to make decisions. And, the irony is we had did a mock. We took one day and did a mock trial on online school. We was like, hey, let's just try it just in case something happens. And we weren't even thinking about the coronavirus at that point. We were thinking about, hey, what if we have a day where, because we're up here in First Hill next to St. James Cathedral, what if there's a huge funeral one day and we don't want to actually miss school, but they need to use our facilities? This is something we can kind of, practice. Well, March 12th comes. Well, let's go. March hits, and we see all these schools starting to cancel. And because of athletics, we sometimes try to mirror our schedules with Seattle Public Schools. So once they canceled school, it was like, hey, sorry, man, we're going to have to cancel school. So March 12th comes, we cancel school, in-person school. Fortunately, we had already had some infrastructure to do online school. So March 12th hits, boom, I'm home. All the protocols are out now. Wear gloves. It's still new. Wear gloves everywhere you go. Don't wear gloves. If you wear gloves, make sure you switch your gloves, throw them out because you don't know. Wear a mask. All this stuff is new, Tony. Right? So I'm at home and I'm going to the store and stuff, but I'm following the rules. I'm a rule follower. Man. And so I'm wearing the mask in the store. I'm doing the things I'm supposed to do. April 7th, I remember this. I will never forget this. April 7th, I get home. My wife had made some sweet potato quesadillas. One of my favorite things that she makes. She made some sweet potato quesadillas. And I sit at the dinner table and I'm like, man, I'm not really that hungry. She looks at me with a side eye like, what do you mean? I'm like, yeah, I'm just not feeling well. Woke up the next day, Tony, opened my eyes. I felt terrible. I'm like, man, I just don't feel right. But me knowing that, I'm not a sickly individual, right? I wasn't thinking I had COVID at that time. I'm thinking maybe, I just caught the bug, and I'll be all right. But thankfully, a quick thing, my wife, she's like, well, we don't know, so let's get the kids out the house. Immediately we send kids to grandparents' houses, just as a precaution, to make sure they were safe, and, I told her she could leave, but thankfully she didn't. So she's bugging me, man, we could be stubborn sometimes. You need to go to the doctors. So finally, on a early Friday morning, I'm like, all right, man, you're going to keep bugging me. Let's go to the emergency. Go to the emergency. They do 3 tests.
Okay, I'm going to stop you right there for a second, just to put this in some context. What were the symptoms that you were having, so that we can get a sense of her urgency for you to go to the emergency in the morning? What was going on with you at that time?
Fever. The fever was high. The cough. I have the cough. Body aches, hot and cold chills, and loss of appetite. I had every symptom except I didn't lose my sense of taste or smell.
Okay.
But because I didn't have an appetite, that really didn't come into play. So we get to
you were on your way to emergency, and again, you're listening to Rainier Avenue Radio .world. It's me, Tony B. This is our special impacts of the coronavirus. Our guest is a beloved member of our community, Mr. KeAndre Magee. If you're just tuning in, told a little bit about his story, and of who he is, and O'Day, and played football here, and went on to college, got his master's counseling, teaching at O'Day now, and And then back in March of 2020, telling us a story about how April 7th, the day he'll never forget. And now we're about to go to the point where your wife has said, get to the emergency room. Tired of playing with you, KeAndre.
He was tired of playing. So we get to Kaiser. They run 3 tests. And Tony, as you know, prior to that, everyone kept saying this is just a flu on steroids. This is just a whole flu. This is just a flu. This is nothing. Right. So I get 3 tests: strep test, a flu test, and a COVID test. Strep test, boom, negative automatically. We know it's not strep. Flu test, boom, negative. We know it's not the flu. They test me for COVID, but at that time they didn't have rapid tests. Right. So they come back, they call me Saturday morning. Hey, you're COVID positive. Dang. I'm like, man, how did I get this? Who did I get it from? Where did I get it from? I'm not sure exactly what's going on, but because I was following the rules. I'm masking up, I'm gloving up. I just didn't know what happened. So now everybody's out the house, and the way our apartment was set up at that time is the main bedroom was in the back and it had a bathroom in it, so I was really able to isolate immediately. First week symptoms, it just got worse, right? The first week, Tony, my fever for an entire week, I had a 24-hour fever. My fever was always between 101 and 104.
Wow.
Couldn't sleep, couldn't eat. I just couldn't do anything. And all I could think about was, okay, keep my eyes open. Because prior to me getting sick, the weekend before, I had read a story on this 30-year-old, younger than me, mind you, 30-year-old in another state had COVID, went to the hospital, emergency room. They checked him out. He was fine. They just said, hey, you just go home, right? He was with his wife. 2 a.m. He texts his wife, hey, I'm kind of struggling. I'm not feeling good. And she goes in and checks on him. Tony, can you hold on 1 second really quick?
I'll hold on for you, bro. Yeah. You're listening to Rainier Avenue Radio .world. It's me, Tony B. My guest is KeAndre Magee. I know many of you out there in the community are familiar with KeAndre. He is telling his story about his experience with COVID and contracting COVID at a time when there was very little information about what was going on there. And I got to get you on there. And here we are quite a while later. And I just think that this is a wonderful opportunity for a member of our community to share his experience as we try to understand what to do about COVID as a community. Of course, everyone knows that coming up are mandates where you're going to have to show vaccine verification to get into businesses and go to school. And that in itself is an entirely different conversation. As a matter of fact, at 2:00, we'll be talking with someone from the Seattle Parks and Rec about those new mandates, and you'll have to show verification to get into swimming pools, community centers. Talk about that later. But KeAndre, you're back now. Go ahead.
Yeah. So, I read the story about the guy, wife. He texts wife at 2 a.m. He says, I'm not feeling well. She goes and checks on him. He texts her again at 7 a.m. She goes in. She doesn't go check. And then when she goes and checks, finally, he's dead. So this happened the weekend before I got sick. So all I'm doing, I'm like, I can't close my eyes. I can't close my eyes. I can't close my eyes.
And this is in saying that, that's one of the things that doesn't get mentioned much, the psychological impact, especially at that point when we didn't know as much as we know now, and we still don't know a lot.
Right.
That had. Okay, KeAndre, I'm stop talking and let you finish.
Yeah, you're good. So, I'm going through that. So a week goes by, I'm day 6 or day 7, and my fever finally breaks. finally break so I can actually rest now a little bit. But now I'm coughing more, and everything associated with COVID was a dry cough, right? So I'm coughing stuff up. So I'm thinking I'm getting better. I'm not knowing that I had shortness of breath because I just didn't associate it with that. So my wife, she's listening outside the door, checking on me, constantly checking on me. And she finally calls me. She says, FaceTime me. I want you to walk across the room because it don't sound like you're getting better. And Tony, as soon as she said, I want you to FaceTime me and walk across the room, I just started getting dressed because I knew I was going to the hospital. It was going to be bad. Get to the hospital. They run a chest x-ray. Now, mind you, they did do a chest x-ray when I first got tested to see if my lungs were clear. Lungs were clear. Get to the hospital. They do a chest x-ray. Within 5 minutes to come back, you got pneumonia. And then I was in the hospital for 4 days with pneumonia. Antibiotics. I mean, Tony, I couldn't walk 2 feet. 2 feet without coughing up my life. And now I can see how people could die from pneumonia. I mean, it was bad. If my wife was not there, if she had left with the kids because she was wanting to quarantine, to get away from COVID, there's no way I wouldn't have made it because she kept on me about getting up and going to the hospital, and I couldn't even drive myself like at all. It was the worst thing I've ever experienced. Was those 2 weeks where I was at the peak of me being ill. Then I ended up being isolated for 7 weeks.
Now I'm gonna question you on this, KeAndre. You know how I get down. It's street beat. So you're 36, right?
Yep.
What I just heard you say, those were the 2 worst weeks. Everything that you've been through in your life, all the ups and downs, trials and tribulations, challenges. Triumphs. Those 2 weeks that you had COVID were the worst 2 weeks of your life.
Yep. Worse. The worst. Like I wouldn't wish that on anybody. And then you combine the fact my dad ended up getting it. He was on a ventilator for 5 weeks.
Oh my gosh.
So and he had COPD. So while I was sick, I couldn't go see him or try to take care of him. They had to sedate him. While he was sedated the entire 5 weeks that he was on the ventilator. And then he had to really fight through, and now he's on oxygen permanently. So it's a challenge. It's a challenge, but it's all good. Tony, can you hold on one more second for me really quick?
Yeah, you're listening to, and KeAndre is actually at work and took time off of work, his busy schedule to do this. And so again, you're listening to Rainier Avenue Radio World. It's me, Tony B. This is our special impacts of the coronavirus on South Seattle and surrounding communities program. If you're just tuning in, my guest is KeAndre Magee, telling us his story about contracting COVID, his experience, his journey with it. How it impacted not just him, how it impacted his family. And we are going to talk about moving forward again as this became a political football. Should you mask up? Should you not mask up? And then we had a vaccine. Should you take the vaccine? Should you not take the vaccine? All of these things combined with misinformation, disinformation, and historical, and rightfully so, distrust, in particular of African Americans, Black folks, of government and medicine, using us for experiments. KeAndre, are you ready to continue?
Yeah.
You at?
Yes, sir. So my dad, it was a struggle. That 7 weeks I was isolated, and as I was getting better, and then not being able to hug my kids, not being able to, hug my wife, not be able to see my dad, see how he's doing. All I'm doing is going off of phone calls from doctors. It was a rough situation, and that 7 weeks definitely taught me the value of, affection, being able to hug your kids when you want and not taking that for granted, being able to see them and, just being able to hug and see and kiss my wife. I mean, for 7 weeks, I was isolated, and it was mentally. So the mental part, Tony, really doesn't start coming into effect. Well, at least it didn't for me until physically I started getting better, because then now I could think about what I was missing. I think I lost like 25, 30 pounds, which was a good thing. I'm never going to complain about dropping no weight. But coming out
That's
of it
not
was
the way you want to do it, though.
no.
Let's make sure you're putting that out there.
Yeah,
COVID is not a weight reduction thing, right? That's not what you're saying.
Do not contract COVID just to lose weight. Do not do that. But it was a challenge, but we got through it, and I can say again, it's different for everybody. Everybody has different results. For me, after the fact, I didn't have any residual effects. But the same couldn't be said for my dad, who was in that high risk population, right? He's 72, COPD, stage 7 prostate cancer. But he survived it,
KeAndre, as we're talking about this, I think what this shows is people are thinking, well, it's me. It's an individual thing. The reality of it is that you don't know where your father got it. You don't know if you gave it to someone. You don't know where you got it. And so
right.
We're almost out of time here. And again, KeAndre, I don't know if this is putting you on the spot or not putting you on the spot, but in particular in the Black community, there are still hesitancies about whether or not to take this vaccine. People say they are doing the research. There's a lot of information about research. Where are people getting research that isn't readily available to everybody?
Right.
That they're doing this research on. And I'm not telling people they should or should not take the vaccine, but what I will say is the consequences of not taking and the benefits of taking it. So I'm going to ask you right now, KeAndre, what would you say to someone who says, I don't think I want to take the vaccine. I'm not going to take the vaccine.
Well, I would tell them, listen, don't listen to, Facebook doctors or Instagram researchers. If you're really going to do your own research, talk to the scientists, talk to your actual medical doctor, and then make a decision, right? But don't cover up the decision by saying they're going to put a chip in me or they're going to do this. Just say, listen, I don't want to get the vaccine because I don't want to get it. Don't try to scare other people out of getting it, right? I had transition in the beginning, Tony, as we spoke, back early. I wasn't going to get it. And then I decided and started thinking about, for me, my family and people I'm around, my mom and grandmas, so I decided to get it, and being a leader of my household, I got it. And then my wife felt more comfortable getting it, and that's kind of how I decided. But everyone who doesn't want to, I don't want to call them anti-vaxxers, just people who are apprehensive about getting the vaccine. Just, talk to more people who are, unbiased and can give you some objective information on it, and that's what I would say.
KeAndre, I got about a minute left, bro. And I want to give you this opportunity to say whatever you want to whoever you want that's listening right now, locally, regionally, nationally, and even in a lot of instances we have global lists. And this is a global problem. Make no mistake about
it.
What would you like to say as your final comments to our listeners?
Man, I would say for everyone, one, keep your family first. Think about your family, and think about the impact of the people that you have an impact on. Think about those people, and particularly if you're in education, if you're a coach, If you're a mentor, if you're doing anything where you're involved with the youth and our future leaders, you have an obligation to ensure that you're providing proper information and adequate leadership. Attitude reflects leadership. And that's what I strongly believe, and if we want the kids in our community to do better, it starts with us as the adults. And everyone, please don't be afraid of the village. The village will take care of your kids if you allow them to. And that's what I will leave you with, Tony.
KeAndre, thank you for joining me.
No problem.
Good to talk to you. Good that you're still here. And we'll catch you. As you know, we broadcast football games. And so I'll catch you a football game, bro.
Yep, I'll come to a sideline interview.
And I will happily accommodate you. Hey, KeAndre, again, thanks again. And again, all the best to you, your family. And thank you for taking the time to come on the show.
No problem, Tony. You have a good one.
Yep. Again, KeAndre Magee, a member of our community that many of us know, sharing his personal journey and story with COVID. We'll be back, and we're going to talk YouthCare. Are you familiar with YouthCare? Well, you will be by the time that we have this conversation in the next 30 minutes. You're listening to Rainier Avenue Radio .world, the impacts of the coronavirus on South Seattle and surrounding community show. It's me, Tony B. We'll be back right after this. Hey, Daniel.
Your community radio station will provide you with more information. Rainier Avenue Radio.
If you or a family member are 55 or over and need nursing home level care, but want to keep living where you are, check out Providence Elder Place PACE. This program offers healthcare, housing, transportation, and recreational activities. There are no co-pays or deductibles, and it's covered through Medicare and Medicaid. Providence Elder Place PACE works to keep you healthy and in your home. Call 206-320-5325 or visit providence.org Elder Place. Providence.org Elder Place.
The beat of the Fox with nastiness is back on K-Fox Night Beat.
Yo, what's the deal? It's the legendary Hall of Fame DJ Mixmaster Ice from UTFO.
What's up? Who you thought this is? This is Sir Mix-a-Lot.
And this is Terry Lewis.
And I'm Grand Mixer GMS.
What's up, y'all? This is DJ Third Degree.
This is JJ Hudson from the High Children family.
Sunday nights from 9 p.m. to 11 p.m. Pacific Standard Time. It's K-Fox Night Beat with DJ Nastiness.
Bringing back the memories.
Bringing back the memories.
Bringing Seattle's hottest music.
Bringing Seattle's hottest music. Rainier Avenue Radio .world.
That's my noise.
Peace.
Rainier Avenue Radio presents the Community Election Connection Debate, powered by Converge Media, powered by the South Seattle Emerald. Rainier Avenue Radio will be hosting a series of debates. You'll hear from both candidates. You'll hear pro and con voices. We are requesting your participation. Rainier Avenue Radio presents the opportunity for you to hear directly from candidates about issues and concerns related to your interests. Rainier Avenue Radio provides an opportunity for the candidates to secure your vote. It's your vote, and your vote matters. What's important to you? These debates will cover a combination of topics in response to issues deemed important by our communities and specific issues that impact South Seattle residents. You have the opportunity to submit questions for the moderators. Moderators will include Rainier Avenue Radio on-air personalities, community members, people just like you, business leaders, local media, and local journalists. Watch live on Rainier Avenue Radio .world.
You're listening to Rainier Avenue Radio .world. Check us out on social media, Facebook and Instagram, Rainier Avenue Radio .world, and on Twitter at Rainier Ave Radio.
Welcome back to Rainier Avenue Radio .world. It's me, Tony B. Happy to be here to share these stories with you about the coronavirus. This is our special impacts of the coronavirus show on South Seattle and surrounding communities. If you just tuned in, you missed a remarkable, basically telling of his journey through COVID by a beloved member of our community, KeAndre Magee. Played football at Rainier. Now he's back and he's working with O'Day. I don't remember the exact title. Got his master's degree, and congratulations to KeAndre. But if you missed that story, you definitely want to go back and listen. Whether you believe you should get a vaccine or not, you should go back and listen to the story that KeAndre has shared about his journey. Called it the worst 2 weeks of his life. While he had COVID, his father got COVID and he couldn't see him. His father has long-term effects and is still on oxygen constantly. And he shared how during that 7 weeks he couldn't hug his kids, couldn't hug his wife, couldn't. Anyway, this thing is still here. We had a conversation last week about the global impact of COVID and how what they call vaccine nationalism is taking place, where, of course, you're not going to be surprised that this poorer, less wealthy countries are not getting the vaccine. Here's the deal. If the poorer countries don't get the vaccine, then the virus continues. And it continues to mutate. And it keeps trying to live. And so we can't escape it. So you make your own decision. But if you're talking about, I'm still doing research. Well, from where? On what? Show it. And maybe we'll find out something new. But so we're here, as we started this, when we were in the phase when we didn't know what it was, that's where we were. We know a lot more now. We still don't know everything. Oh boy. Anyway, a little bit later in the program, if you're tuning in, Justin Cutler will be joining us from the Recreation Division, Director for Seattle Parks and Recreation. We'll be talking about, again, the screening mandate and implementation of the mandate for Seattle recreation facilities, since you have to show verification that you've been tested. At 2 o'clock, half an hour from now, the Associate Director of Workforce Development for YouthCare will be here talking with us. But right now, I think it's wonderful to have this conversation after talking to KeAndre, and I want to make sure I say the name correctly. Dr. Telbin Mullet. Doctor, did I say your name correctly?
Hi. Yeah, it's Dr. Thelbin Mullet.
Thelbin.
So very close. Yeah.
Okay.
Nice to be here today.
I tried to be smart and act like I knew something and say, okay, the H must be silent. I'm just going to go with this.
It's not that complicated.
Well, thank you, Dr. Telbin, a board-certified pediatrician who completed her medical training at the University of Illinois College of Medicine and pediatric residency at the University of Washington. I know I have on a USC dad t-shirt right now, but I'm a Husky, so she highly values providing standard of care that is up to date and evidence-based. Wow, that alone says a lot. I think you may have heard my monologue a bit before you came on, but evidence, based, up-to-date current information. Loves partnering with patients and families at Odessa through the shared decision-making. Dr. Mullet's an outspoken advocate of child health, social justice, and anti-racism, and has developed a curriculum for medical trainees focused on addressing health inequities. That's enough, and was enough. As was a matter of fact, it was too much. And then you add a pandemic on top of that for a very contagious virus. I'm going to start off, and you answer this however you want to before we get into, I guess, the technical jargon or whatever, which I try to avoid those $25 words. But I'll just start off with this, Dr. Mother. How are our children doing?
Yeah. That's a really big question.
Yeah.
Because that, I think, takes a lot of different, there's a lot of different ways to address that question, because obviously we have what the actual coronavirus, how that's impacting kids from just an infection standpoint, but also kids have been out of school and now are going back to school. And so their daily routines have been really disrupted, and families are trying to just readjust to that. And we've seen the pandemic really impact, in my clinic, for example, thinking about my patients, really substantial ways in terms of mental health, repercussions as well. So even pre-pandemic, we had a mental health crisis in this country. And during the pandemic, we saw a lot of adolescents and children even have increased rates of anxiety and depression, a lot of social, obviously, isolation with needing to be quarantined or just needing to self-isolate from others in their communities, and obviously being out of school. And so I've just seen an uptick, and I've had to also refer my patients more to mental health services, and we don't really have, there's already a disparity of mental health, like workers, healthcare workers or providers, behavioral health providers anyway. And so we're seeing that impact. Yeah, it's really, it's a lot, and we can kind of parse out some of that a little bit more, but just want to start by saying that there's a lot of different issues that this pandemic is having for our children.
So, what I get out of what you just said is that children are not okay.
That's correct. I think I don't want to treat children as a monolith. I think obviously some families and some children, especially with resources and community supports, are able to cope a little bit more than others. But I think in general, this has had a significant impact on children's well-being. Yes.
And it is one of the measuring sticks of a community. How are our seniors doing? How are our? It is just, and I understand that it is not a monolith, but it's important. So thank you for answering that question. Well, let's take a look now. Vaccines that will soon be available. What is and what has been the essential well-being in regards to COVID and the impacts of COVID on our youth? Adults have been able to take the vaccine for a while. We're getting approvals for youth. I'm starting to see some things and have seen some things about the impact and the effect that this is having on youth. In general, if you're young, if you're under 12, if you're 5 to 12, and you're healthy, can you generally expect not to have severe effects from COVID?
Yeah. So children, we know, can get infected with coronavirus the same as adults can be infected with coronavirus. We know that if you have underlying healthcare or underlying health conditions, that obviously you are probably at a higher rate for having more serious complications if you do get the virus. And that is the same for children as well. Your question with if children are, in that age group of 5 to 12, or, now that 12 to 19-year-olds are able to get the Pfizer, if they were to get a coronavirus infection and they are otherwise healthy, then we are seeing that those infections tend to be mild. They may present as like a cold. They may have, a runny nose. Some kids can still have fevers. They may have a cough. Some kids can go on to have more, serious symptoms with difficulty breathing. And so you might see them struggling more, and they may need to present either to their primary care office to be evaluated or to an ER or an urgent care setting. So in general, that's kind of what we are seeing as a baseline in terms of how children, are how they actually present with symptoms. I will say that so far in the US, we've had about 6 million children test positive for coronavirus, and about 1 million of those cases have been since September. And we think that that is because of the Delta variant.
Since September?
Yes.
September 2021?
Yes.
Okay.
And we think that that is because of the Delta variant. So I want to stress that we don't think that the Delta variant could, potentially impact kids more seriously in terms of their symptoms any more so than the other variants that we've seen. But we do know that the Delta variant is more contagious, right? And so that just increases the chances of those kiddos potentially spreading the virus to other unvaccinated persons like children or even adults who, again, might have some of those underlying health conditions and might go on to have more of a severity of disease.
During this time, before the pandemic, kids were getting sick like they normally do. Kids were breaking bones like they normally do. Things that happen to our youth were happening like they normally do. Have you noticed that the visits to hospitals during the pandemic have increased, decreased, or pretty much stayed the same? Do you have information about that?
Yeah, I can't tell you exact numbers in terms of what, for example, like Seattle Children's may have been seeing, or like Valley Medical Center, just thinking about some of our hospitals who have ER capacities where children might present. What I can say is that we know that for some of the other things that patients would present for, so like a broken arm, that would be something that's urgent and that would need to be addressed. But if you had diabetes, for example, or if you had other kind of health conditions that are needing maintenance for that, those folks were experiencing delays in their care. And that was because of the impact of taking care of patients who were, who had coronavirus and who needed either the urgent care or ER space, or who needed that hospitalization. So we know that healthcare services during the pandemic, and again, it's ever changing. As vaccines have come out, we've been seeing changes in terms of what that looks like for communities. And so that's not the case right now. We're able to really address a lot of different issues for patients. But you are correct in that during the pandemic, there were times where the services were not, people were having delays in care because of having to reallot services to take care of patients with coronavirus.
And again, Dr. Millett, you may not have the answer to this question, but would you say that was due more to the stress on the healthcare system, or was that more on parents going, hey, we're isolated, I don't really know what's going on with this virus in general, I'm not trying to have my kids, they're not going to school, I'm not going to go take them to the hospital. I mean, I'm just trying to figure out what it is, and you may or may not have that information to be able to discern, because I don't know if it's available or not. But was it hesitancy, or was it just that no, parents still wanted to take their kids to the hospital, but the system was too stressed and they couldn't do it?
Yeah, I think you're right. I don't have the exact information. I think it was probably a mixture of both. I know a lot of clinics, like telehealth and telemedicine became, and it still has, especially in my clinic, it's become really central to how we operate and how we're able to have, provide access for our patients. And so I think as people, including the healthcare system, we were trying to adjust to what was going on. There were just different phases of using these resources like telehealth more. So I know we were getting on the phone more with parents, for example, and triaging things over the phone so that families didn't have to necessarily come to clinic or come to the ER or come to places where, you know, they may have a healthy kid otherwise, but they may be exposed to someone who had COVID, for example. And so that was something that was going on kind of early on. And then we were able to operationalize our telehealth capacities more and increase that availability for families. So I think telehealth has really evolved during this pandemic, and it's become really a crucial piece in terms of how families have been able to access healthcare services.
You mentioned in your bio health disparities, and that's a term now that I think more folks are familiar with since the pandemic. But I do want you to address that with the. I'm going to ask you a question, but first of all, just for anybody who may not know, when I say health disparities and you say health disparities, what are we talking about?
Yeah, so generally, I really like to think about health disparities as the kind of consequences of what we call social determinants of health, right? And so that has to do with your environment, that has to do with your access to safe living spaces, your access to clean water, your access to clean air. That has a lot to do with kind of the structural things, I want to be a little bit more specific than things, the infrastructures that we have in our society, in our governments, in our like day-to-day living. So that could be the communities that we live in, and that can be our ability, again, to access fresh fruits and vegetables and the grocery stores that are in our community. And we know that historically, folks are disproportionately impacted based on race, based on income, and based on other things that could potentially put them at risk for having increased exposure to air pollution, for example, that could then exacerbate underlying health conditions like asthma. So just to give a concrete example, when we think about Black and Brown children who have asthma, they are, 3 to 4 times more likely to have to present to an ER for their for asthma exacerbations than white kids are. And we know that that is in part due to social determinants of health, meaning their potential exposure given, where they may live. We also know that Black and Brown children are less likely to live in communities where they may have trees. And so there's, and I don't want to, again, overgeneralize, but there is data out there that kind of goes into more detail of the communities in terms of how these things impact our communities. But that's what I'm talking about when I talk about health disparities. I'm talking about the risk that are associated with social determinants of health.
My guest again is Dr. Telben Millett, a pediatrician. We're talking about the impact, the health of our youth and adolescents in general, and the impact of the coronavirus on that health. So thank you for that explanation. Now, having said that, since the pandemic has begun in this period that we're in right now, for our youth, again, we hear a lot about the adults, but for our youth, what kind of care in the health industry are we getting right now? Is it, and I'll just say, is it better than before for our youth? Is it the same as before for our youth? Or is there now more awareness? And are you going to make everybody happy and excited and say our children are getting better health care now that the gap in the disparities has decreased?
Yeah. Unfortunately, I don't have a magic wand to say that. And And I can't say that things are better or worse. I will say clearly they are different. And I think that we've had to be innovative and to think outside of the box and to really, keep what we call like health equity and health equity mindset, and to be aware of those health disparities that I just mentioned as examples. But obviously there's so many more, and we've seen that specifically with COVID-19 and its impact on certain communities of color. And we've seen that throughout the pandemic. So I think that it's really difficult to answer that question in terms of the specific services that families and that our youth and our children are getting. We are offering standard of care. And so those services are the same as they were before the pandemic. And we are offering additional services that has resulted because of the pandemic. So obviously, Odessa is a vaccination site, and we are vaccinating against COVID here. And that's for both children and adults. And so that's just one example that I can, think of right now for that.
And you know what I'm getting at. We don't all have medical backgrounds, and we do know, some of us do, and some other folks know our history. And at the end of the day, the question is, okay, we've experienced this. Those of us who have lived health disparities and how that impacts and how we die before we even get health care. And so I think that's a legitimate question, and I know there may not be an answer to it, but it doesn't remove the fact that it's a question. How are children,
I think
this healthcare
key
environment?
thing, Tony, the key thing too with that is I think we are learning that we need to bring services to families where they are. And so we can't always plan everything for when families come into the clinic, or when families, we're in schools, we're in other places, but how do we reach our families in the community where they are? How do we expand on our current services that we offer families? And how do we make sure that we are keeping access in mind, right? And so, you might have all of these healthcare services, but if people aren't actually accessing them, what help is that doing to them or for them? So I think, again, we've had to be very creative and innovative. And a lot of that has come from listening to our community, listening to what our patients and families are saying, and really trying to meet their needs.
It's a moving target. We just and thank you for joining. We've only got a couple minutes left. I got a couple questions. The first one,
of course,
Dr. Mullet, is how are you doing, and how have you been doing throughout of all of this, and in your unique position of where you're at in this process?
Yeah, thank you so much for that question. I think I am. There's been phases where you're tired and you're just kind of like, especially before the vaccination rolled out, just trying to see the light at the end of the tunnel. And I think now that we have this tool of vaccination, I think that kind of has provided some space to breathe. I think we have to continue, though, to have these conversations and to acknowledge that, there is, I'm validating the concern that COVID has disproportionately impacted communities of color. And I'm validating, too, that we continue to see gaps in immunization rates. And so I think, that was initially due to access, and now it's more misinformation. I think there's some confusing information and misconceptions, and then obviously the historical trauma piece. And so I want to continue to, again, have conversations like this. And I encourage families to talk to their healthcare providers about their specific questions for the most up-to-date information. So I think I am hopeful that through these conversations, people will continue to utilize this amazing tool that we have in terms of the getting the COVID vaccine. It's kind of our number one thing that we have to fight this virus, in addition to some of the other preventative measures that we can take. That's what I would say to that.
And Dr. Mullen, I have about a minute left. This opportunity is for you to share however you'd like to share information with those who are listening right now in our communities and our surrounding communities.
Of course. Yeah, thank you so much. So I just want to let families know that, again, here at Odessa, we provide vaccines, COVID vaccines, to anyone who wants one. You do not have to have an appointment as long as you come into the clinic during our open hours, and that's 8 a.m. to 5 p.m. Monday through Friday. I also want to encourage you again to speak to your child's healthcare provider. If you have any questions, to get the most updated information and recommendations. Again, I realize that there's a lot of confusing information out there, a lot of misconceptions. We have families who are afraid of side effects, for example, from the COVID vaccines. And then I recognize, again, that there's a piece of historical trauma. But I want you to know that there are places that in the community, for example, like Odessa, where you can get a vaccine from folks who care and that you can trust. So that's where I'll end it.
All right. Well, thanks for joining us on the show. Be great to have you come back again in the future so we can get another, I'll just call it a temperature check on where we're at. And thank you for what you do.
Of course. Thank you so much for having me. I really appreciate it.
You're listening to Rainier Avenue Radio .world, our special impacts of the coronavirus on South Seattle and surrounding community show. A little bit later in the show, the Recreation Division Director for Seattle Parks and Recreation will be here to talk about vaccine verification. Starts Monday. And next up will be the Associate Director of Workforce Development with YouthCare. If you don't know about YouthCare, you're about to find out. And of course, we're going to also talk about how the changing landscape of coronavirus has impacted the work that they do. We'll be back right after this.
This is Paul Pearson, host of Star Time. And when I'm not driving my sweet AMC Pacer through the car wash, I'm listening to Rainier Avenue Radio .world. You missed a spot.
Listen up, y'all. It's a Halloween Day event. Are you wanting to participate in a trick-or-treat wonderland? Well, on Sunday, October 31st, 2 to 5 p.m., Champs Resource and Service Center and Urban Impact want to collaborate with you and many other partners, residents, volunteers, local businesses, churches, and organizations to host the 7th annual Boo Bash at the beach. Where? Well, the Rainier Beach Community Center is where, and there are many ways you can support, so visit rbboobash.org/support for more information. rbboobash.org/support for more information on the 7th annual Boo Bash at the beach.
This is Monique Lee from the Afternoons with Monique show. I'm also the owner of Seattle Love Broker, a relationship consulting and matchmaking company. Tune in every Thursday afternoon at 1 p.m. to listen to intriguing, informative, and entertaining guests share stories of their past and vision for the future of our community.
1, 2, get down! What's up, big and little homies? This is Masvita Maraire, host of Seattle Sports Weekly on Rainier Avenue Radio .world, your one-stop shop for Seattle sports. We cover preps, we cover college, we cover pro, we cover it all. Huskies, Mariners, Seahawks, Garfield, South, Roosevelt, Petro, King County. This is where you want to listen to for all the sports that's happening in Seattle. Seattle Sports Weekly on Rainier Avenue Radio .world.
See a bad
This is Tyrone with God Is, and the inspiration of gospel music also on Rainier Avenue Radio .world. We give out free food each and every Saturday from 11 to 2. And so we want you to come on out and support us when we love on your community. And we also have a fish fry once a month. We want to raise funds, put back into the community, And so come on, support us. We need your love. And also, if you want to be connected with us, go to Rainier Avenue Radio.world, to the website, Facebook, Instagram, and God is. And as God is got a website, we need your help, community. So come on out and get your free food each and every Saturday it is. And so we asking for donation, whatever you feel to give from your heart to the mind. And as we're doing it right here for you, go to our website and touch love and give back. And so come on by 810 23rd Avenue, Rainier Avenue Radio.world, your community radio station and inspiration of all the things we do in your community.
This is Rainier Avenue Radio.world.
Welcome back to Rainier Avenue Radio.world. This is our special impacts of the coronavirus on South Seattle and surrounding communities program that we do every Friday from 1 o'clock to 3 o'clock. If you are just tuning in, you missed a wonderful conversation with KeAndre Magee sharing his story about contracting COVID very early in the process and what that was like for him. If your name sounds familiar, yes, that's our own KeAndre Magee. Folks around here know he's also now at O'Day, where he's teaching there, instructing there, and also coaching football. And we also just had the opportunity to speak to Dr. Telvin Millett and find out from the perspective of our youth, our adolescents, from the doctor, pediatrician, what's going on with our kids during all of this. Obviously, we know that there are some mental health impacts. They're all over the place, and physically also, how is this impacting our youth? So go back and check that out as well. I appreciate Dr. Millett's candidness in answering those questions about our youth. A little later in the program, once again, we're going to be talking to the Recreation Division Director for Seattle Parks and Recreation about the upcoming vaccine mandate and vaccine verification that you'll need to get into some of these community centers and places that you're used to going, and now you're going to have to show vaccine verification. This thing is something else. Joining me right now, and I want to make sure that I say the name correctly, because I think it's Erica Lyman, but it might be Limon because I see an accent over the O. And so I'm just going to bring Erica on, and we'll just figure that out and get it straight. Erica, can you pronounce your last name for me, please?
It's Limon.
Limon. Okay.
Oh, the second one. Yeah, you were right.
Kind of the second one.
Yeah.
I said Limon. Well, thank you. Erica is Associate Director of Workforce Development with YouthCare. And YouthCare is a local Seattle nonprofit that provides services to homeless young people. Erica has been at YouthCare for over 3 years and has overseen several programs from the young adult transitional housing to workforce development program. That's what we're talking about with Rainier Avenue Radio. Yeah. Erica believes that providers, community members, young people, business owners, organizations, etc., need to come to the table and work collectively to dismantle systems that enhance the narrative and pathway of just pull yourself up by your bootstraps if we ever going to create real change. And actually, that's what we're talking about, Erica, about getting some YouthCare youth to Rainier Avenue Radio and be part of our program is preparing youth for a 21st century job marketplace out there. So
we
excited
are very
about
excited
that.
about that.
Yeah. But we're here to talk today about YouthCare. So why don't we start with this, Erica? I gave a little background information on you. Let's talk about YouthCare. Give us not the nickel tour, give us the 50-cent tour on YouthCare, who you are, what you do, how long you've been in existence, and why you exist.
Yeah, YouthCare is a Seattle nonprofit, one of the largest nonprofits in Seattle serving youth homelessness. We've been around a little over 40 years now. If our development folks are watching, I probably got that wrong, but a little bit over 40 years. Initially started as a shelter for adolescent age. And then, over the years, YouthCare has really expanded our services. So, we do young adult housing, adolescent housing, and shelter. We do education and employment programs, which is within our workforce development programs, preventative services, shelter services, drop-in and engagement services. So we're kind of all over the board, all throughout Seattle area. And our primary focus is providing services for young people who are experiencing homelessness.
All right. How long have you been in existence?
A little over 40 years.
Uh-huh.
So we've been around for quite some time in the homeless community.
And are you a national organization?
No, we are not a national organization.
Are you local and specific to Seattle?
Yes, YouthCare is yes. I live further south than Seattle and keep hoping that we'll do a Tacoma location, so my commute's not too bad. But YouthCare is very established in the Seattle community. We believe that Seattle is our priority, because you look around and you see the need everywhere. And young people can do so much, if somebody just believes in them. And we really believe that if we empower young people can come back and young people shape the system.
Talk to me a little bit about unsheltered and homeless youth. And it's probably, homelessness in general is something we don't want to see. And when it's in our face, we have a problem with it.
Yeah.
But let's unsheltered homeless youth. Tell me about that.
Yeah. So, young people experience homelessness for a variety of different reasons. A lot of it is systemic. And how, the community looks at homelessness is very different depending on age groups. And we see that when we do program matrices, when we see that when we design programs, we see that when we go out and get money, right? How do you pull on the heartstrings? How do you story tell? Things like that. But young people experience homelessness for a variety of different systemic reasons. And BIPOC young people experience homelessness at disproportionate rates than their white counterparts. A lot of it is, a failure in foster care systems, and young people who have experienced homelessness and houselessness the entirety of their lives. We have a lot of young people who grew up in the economic downfall and they've never experienced stable housing. And so, we have a lot of young people who this is their reality, this is their everyday life. And it expounds with a variety of different things like mental health needs, substance use, different areas of development. We also see it, young people who are being trafficked come through our doors as well. And it takes everybody coming to the table to really think critically of how do we support young people in navigating through this journey? How do we coach them to access different resources? And during the pandemic, I think a lot of things were brought to light. Specifically when it comes to youth and young adult homelessness. You saw the disparity in access. You saw, socioeconomic status come into play. You saw race come into play. You saw LGBTQIA identity come into play. And all of these things were expounded on, and it forced the community to really see it, I think. You had school systems really seeing the impact of homelessness and houselessness, because it wasn't just like, cool, switch to virtual school, right? It was your youth shelter doesn't have Wi-Fi that works all the time, or you don't have access to tech, or you don't have access to X, Y, and Z. And I think that it forced a lot of different systems to focus on that and to really see how spread homelessness really is.
You're listening to Rainier Avenue Radio World. It's me, Tony B. My guest is Erica Limon, Associate Director of Workforce Development with YouthCare, local Seattle nonprofit. And again, I'm glad to have this opportunity to talk about YouthCare and learn more about YouthCare, who you are and then who your clients are. You kind of started talking about it in talking to Bella. One of the number of things that the youth like to do in the shelter was there was a facility to play music and musical instruments. Well, when coronavirus came along, isolation came over again for our youth as well. And again, I'm happy to have this conversation because you can often forget that our youth are also unsheltered and homeless.
Yeah.
In addition to everything that else is going on, like you said, well, what about school? What about other this stuff? Well, I don't have a stable home.
Yeah.
And then on top of it, now you can't go to a place where you congregate with peers who have similar things that you have, which make life a little bit easier, a shared identity, and you can't even go there. How did this change? How did the pandemic change the way you do your work to accommodate, again, youth who are already under incredible pressure and stress? And now there's isolation and they can't talk, they can't go anywhere. Home, if there is a home, may not even be the place that they want to be. And now they're told to stay there and lock down.
Yeah. Thank you for that question. That was something that was really hard, I think, for not only YouthCare, but the entirety of organizations that are providing services to homeless populations. It went from, we want to build this community, we want to arrive to this work together, right? How do we congregate in spaces and heal? And it went to, well, you have to be 6 feet apart and like you're too close to each other. And, and a lot of people felt the anxiety and the enormity of the pandemic and didn't have a way to just exist. There was, well, we can't, you can't share mics. Because you have to have a mask off for a mic, for a mic to operate properly because air has to blow through your mic. So you can't share mics. So you can't, do the music that you want. You can't share different music tools or tech, or, a soundboard has to be operated by an individual person. And so a lot of things that young people utilize to build community, center themselves, heal, essentially were isolated, and it built on that, and we had young people congregating 6 feet apart in a building, but couldn't actually be together. And that's sad and hard to know, hey, my friend, my support system is right here and I can't even hug you. And it was everywhere. We had staff who, our staff too, right, are impacted by this as well. We have staff with lived experience, myself included, that are impacted by this. Like, I see you, I value you, I know this is hard for you, but I don't know how to support you. And I think that was also the same way with our young people, and all of their brilliance and wonderful capacities and abilities. They were siloed. And, it's been a real challenge to try to get out of that. We've seen lasting impacts, right? Like, we specifically, the department that I oversee now, which is education and employment programming, we focus a lot on, like, how do we recruit young people to come into these spaces and these cohorts of programs to support them in healing. And young people, and, we forget to have the conversation that young people need to stabilize first. We've been giving this narrative that we can't collectively be together, that now that we're starting to, young people are like, can I trust this? And I don't think that we focus on building the trust enough of yes, you can trust this. Yes, we can come together. Yes, we can be in community. And I think that, we're in a rush to get back to normal, that we haven't paused to really see, how do I focus on stabilizing you in this, in accessing these services? How do I get you just to trust that we can collectively be together and it's safe for you? And, you're not going to get sick. And, You're not going to have, the impacts of COVID hit you harder, or you're not going to be looked down on if, you're coming in at different proficiency levels. And so it's been interesting. It's been a wild ride, specifically operating in COVID. And I think that now we're at a point where we have to really reimagine what we're doing. The type of youth work that we are creating, is this really going to work? How do we support the different balancing of young people coming to the table, and how do we heal first? And then, look for that engagement aspect next. And I think that's something that oftentimes we try to brush over. And I think our system is part of why we are like this too, right? Last year, for a lot of city contracts for nonprofits, and county contracts and federal contracts, we were held harmless for outcomes, and it allowed for us to continue services, and not be focused on numbers and funding and all of these different things. And now it's like, well, that you're held harmless, time is up. So now I think that we are so much focused on how do we get numbers, and not how do we really support young people with healing, that is so necessary, especially for our BIPOC young people. COVID disproportionately impacts our BIPOC community, and we know that our health system is not as accessible to our BIPOC community. And so, it's a lot of different isms coming to play and coming to light and intersecting at this crossroad. And I think right now we're at a pivotal point of where do we go from here?
You talked about a number of things, and one of which was another impact, which was, the funding that was necessary and the bureaucracy that was involved in that funding at the time.
Yeah.
And you say folks wanting to get back to normal initially, but then I know that people realize, what, I don't want to go back to that either.
Yep.
So whatever normal wasn't cool for me. Being unsheltered, being homeless as a teen, if that's not the normal I want to go back to. I want something different than that. And with that thought in mind, and again, as everybody's going this, what was the process that YouthCare said, okay, well, wait a minute, we are essential in that. I mean, we can't really work virtually when we're housing unsheltered youth. You can't really do that virtually.
Yeah.
So how have you repurposed what you have done moving forward? If you didn't catch at the beginning of the show, a lot of people are planning out now till 2025. It's still 2021 in how they're going to deal with coronavirus and the impacts of the coronavirus. We talked yesterday about the fact that this is a global epidemic. Whether people want to acknowledge that or not, if you don't fix it in countries that don't have the vaccine, and some are only 2% of the poor nations have been vaccinated, you're not going to be safe in South Seattle either. And we had a world global health officer come on and break that down for us. So how are you preparing, and how does this change the way that you think that you're going to, because you really can't go virtual. People need your services.
Yeah. So what we did initially in the beginning of the pandemic was all of our community-based programming, we essentially paused. So, folks that were going out into the community, we really recentered and refocused. How do we ensure that we can maintain our basic services? So our shelter programs, our housing programs, how do we make sure that we can keep these doors open and these young people housed? And so we also then increased occupancy for our shelters and our drop-in centers, because we really wanted to focus on how do we, still have a place for young people to come, and feel a little safer. Right now we're currently in talks as a wider organization of where do we go from here? How do we reimagine services? That's been something that we have been talking about for months now. how do we reimagine what our services are going to be? And you're right, like the virtual doesn't work. For some programs, for instance, we ran an employment program that was virtual, and young people gave feedback of like, this really didn't do anything for me. I didn't learn anything. I wasn't focused on engaging. And so virtual isn't going to work. One of the things we are doing right now is we're doing smaller cohort sizes, but more frequent cohorts. That way we still have the ability to operate different programming. We are also thinking of, are there different sites that we have access to? That we can still be able to engage young people. And then we're also talking a lot and thinking a lot about how do we truly lean into restorative justice practices. One of the things that I think the pandemic really highlighted was that we had a disparity in service providing. We had a disparity across the agency of how young people of color are receiving services. And the pandemic forced us to reckon with that. And so right now, a lot of our conversations too are, how do we really lean into restorative justice practices specifically for young people coming through our programs? How do we lean into our anti-racist statement? What does it mean? And how do we also then allow for access and provide that pathway for young people to have a very tangible power in their services. So all of these things are things that we are in conversations of and building supports around to really see how do we continue to operate our services post COVID-19.
Erica, tell me, I mean, this conversation is what it is. Maybe for some folks, it's like, wow, this is gloomy. Well, you know what? It's not been all, unicorns, but there have been, again, some of our community members who have done outstanding work, stepped up to the plate and done amazing things. Small businesses, that our healthcare professionals, our essential workers at the store. There have been amazing things that have taken place during this pandemic that have shown the resilience of our communities and of our spirit. What are some of the things at YouthCare that you'd like to share with me right now from the youth who've participated in your program, that you can say, wow, if only people saw this or heard about this or knew about the strength and the vitality and the creativity that y'all are exhibiting. What are some of those stories?
Yeah, I love that question. Thank you for asking it. We have seen some incredible successes during COVID too. Last year I was operating a program, a housing program that primarily provides services to refugee and BIPOC young people. And we had all of our young people, five young people didn't have their high school diploma or GED. All 5 of them obtained their high school diploma or GED in the middle of a pandemic. Wow. That was exceptional and we celebrated that. So they were like, well, I'm not going to let anything stop me. And they did it. We also saw Kaiser is a partner of YouthCare, and they came in full force to maximize healthcare support for our young people in our different sites. They provided additional testing sites and additional vaccine sites, and they opened up their medical hotline to widen the access across the agency, and that was pivotal. That was an exceptional thing that we had greater access for young people to engage in the healthcare system. We also saw young people build community, even though they had to social distance, even though they had to be apart. We saw young people provide really clear feedback of like, hey, this program isn't working for me, and in these different ways. And then we changed programs to make them better for young people. We also, I'm so grateful to have collaborated with University of Washington Doorways program. And we piloted a healing-centered engagement internship opportunity. earlier this year that really it was in connection with the University District Food Bank. And that was such an incredible opportunity for young people. And any young person, I remember we brought it to an individual housing site and 100% of young people participated. And it was a very tangible way for undocumented youth to be able to earn some money, because that's also a challenge. You know, if you're undocumented, you don't have that social security number, and that's super challenging to like gain employment and gain some income. And we were able to make that happen. This department as well transitioned the way that we do stipends and hire people for internships or anything like that. So that way our undocumented youth had greater access and could, get some money in their pocket. And that's been exceptional to really see that grow. So those are just a few of the highlights that we've seen. We also had really great community and collective healing in some ways that really came out of this pandemic.
And I don't often comment on things, unless I'm specifically talking about that issue. But I am going to say this as you were talking. For folks who are saying, well, wait a minute, these are folks who are undocumented and they don't have social because they're not supposed to have job. Okay, so you're an unsheltered, homeless, undocumented young person. What are you supposed to do?
Oh, so
we don't have
the
to
workaround. The workaround is you fill out a W-7.
Mm-hmm.
So you fill out a W-7 to get yourself that tax ID number. Mm-hmm. You don't need to have documentation to have a tax ID number. So you fill out a W-7, you use that W-7 on a W-9, and that's how you are stipend. And then it's also essentially like business ownership is the workaround for supporting undocumented youth with income and employment.
All right. Thank you. Thank you for that explanation. We're almost out of time here.
Yeah.
Erica, my guest has been Erica Limon, Associate Director of Workforce Development with YouthCare. We talked a while ago, looking forward to our partnership so that we can begin to employ some of the youth in YouthCare, have them become what I like to call media content providers and journalists in their own right, to share their own story and share their story with their peers. Erica, I got about 30 seconds left, that I just want to give you the opportunity for final words.
One, appreciate this opportunity. Two, I'm super excited to have our young people intern and host that. I'm really looking forward to that because they are really looking forward to that. Three, it really takes a community effort to end youth homelessness. So, community members far and wide, I really encourage you to rethink the way that we look at our youth and young adults that are experiencing homelessness and be part of the solution.
Thank you, Erica. You're listening to Rainier Avenue Radio.world. It's me, Tony B. Coming up next, I'll be talking to Justin from the Recreation Division Director for North Seattle Parks and Recreation. We're going to be talking about the upcoming mandate that takes place on Monday. You have to have vaccine verification if you want to get into Seattle recreation facilities. We're going to talk more about that here in about 3 minutes. We'll be right back.
No, you can't get enough of Rainier Avenue Radio.world.
And welcome to our live studio audience for another exciting edition of Did You Know? And here we go with round one. Did You Know?
COVID vaccine is free and easy to get. You don't need insurance or an appointment to get your vaccine. Vaccines are available at many locations near you.
And now we're going to double the value. Did You Know?
The COVID-19 vaccine is always free of cost. You can visit pharmacies, community health centers, and other health providers in your neighborhood.
And now for the lightning round. Did You Know?
The Delta variant of COVID is a mutation that has health experts worried because it's twice as contagious.
Then for our finale. Did You Know?
The best way to protect yourself from the COVID Delta variant is to get fully vaccinated. Get your vaccine today.
Find out more at kingcounty.gov/vaccine. Did You Know?
Different rules apply when it gets this late. You know what I mean? It's like after hours.
Whatever gets you through the night. It's all right.
Hello, I'm an unpaid spokesman for DJ Sotovaci. I'd like to invite you to listen to his free-form music show. It's popular music the way it was never intended to be heard. Whatever gets you through the night, late nights, here on RainierAvenueRadio.world.
Whatever gets you through the night.
This is Brenda Charles Edwards, host of Seniors Matter. Join me every week to get information on activities and issues that impact the lives of older adults and their families. That's Seniors Matter every week on Rainier Avenue Radio.
There is no secret why Downbeat Magazine calls this Seattle's most important annual jazz event. The 33rd annual Earshot Jazz Festival hits Seattle stages October with one-of-a-kind live jazz performances and video live streams all the way through November 7th. This year's Earshot Jazz Festival features established masters like Diane Reeves, Chuco Valdez, Dee Daniel, and red-hot young stars like Theo Croker, Emmanuel Wilkins, and Samara Joy, celebrating both Seattle's history and its future in the world of jazz. Earshot teams up with community partners like Langston, the Royal Room, and Rainier Avenue Radio to showcase Seattle's own resident artists. Tickets and more information are available online at earshot.org. That's earshot.org. Once again, Seattle's most important annual jazz event, I believe. Earshot Jazz Festival, hitting stages early October all the way through November 7th. Call for more information.
Would you like to see when your favorite Rainier Avenue Radio show comes on? Check out our show schedule, updated weekly at RainierAvenueRadio.world.
Welcome back to Rainier Avenue Radio.world. It's me, your host, Tony B. This particular program is called The Impacts of the Coronavirus on South Seattle and surrounding communities. This particular program has been running since March 13th of 2020, every Friday from 1 to 3. We have done almost 200 shows on the impacts of the coronavirus. I remember when this first happened, I thought 2 months max, maybe 3, but by summer. Now, it wasn't because I thought it would magically go away. It wasn't because I thought the good weather was coming and it would just disappear. And I definitely wasn't going to inject myself with Lysol. It's been a lot. It's been a lot. These last couple years, 20 months now? Something like that. Anyway, the point that we're at now is there are mandates that will, for some folks, limit what you can do. And for other folks, it's going to open the door up for you to engage in more things. We know this is a political hot button for some folks. It is what it is. And you know how we get down. We just have open, frank conversation. Joining me is Mr. Justin Cutler. Justin, how are you doing?
Good afternoon. I'm doing great. Thank you for having me on your show, Tony. Appreciate it.
You're welcome. Justin is the Recreation Division Director for Seattle Parks and Recreation. We're not creating exceptional recreation services together with his team. He enjoys hiking and spending time with the family. He's excited to be here today and share information on the county-wide vaccine screening mandate and the implementation of the mandate at Seattle recreation facilities. Throughout COVID, the Seattle Parks and Recreation Division has responded by providing shelter, showers, childcare, rec in the streets, beaches, outdoor recreation, and recently relaunched the recreation services under new COVID safety protocols at community centers and pools. So, Jason, first question, I guess, is how are you doing?
I'm doing okay, but I think your opening before this segment was spot on. I too was thinking, hopefully 2 months tops, and here we are, 20 months later and still surviving, but many haven't. And I think it's been hard and we've tried to support community the best way we can. And I'm getting a little tired, and I'll admit that, but still trying to stay positive, support community and support our neighbors.
Well, let's start. I guess we can say pre-COVID, or you can make it
Yeah.
whatever now. But I know that things have shifted and changed. But Seattle Parks and Rec, well, what do y'all do? Who are you? You know, maybe we know
Yeah.
who you are, but a lot of people may not know about Seattle Parks and Rec. Who are you?
Yeah, no, that's a great question. Well, Seattle Parks and Recreation, we have over 468 parks across the city of Seattle. We have over 26 community centers in many different neighborhoods across Seattle, 8 pools. We offer 9 swim beaches. We have wading pools for you to enjoy in the summer. We have outdoor environmental learning centers. We have a ropes course. We even have Camp Long, which is in West Seattle, which has the oldest historic climbing rock. We also have countless programs through our lifelong recreation programs that serves older adults. We have programs for people with different abilities. We have pools, environmental education activities. I'm trying to count the number of golf courses. We have 3 golf courses, I believe, and several beaches and parks. And we also have the historic West Seattle Stadium, which many people enjoy for different track and field events. So a lot happens at Seattle Parks and Recreation, and we're here to help the community stay active, healthy, and connected. So.
All right. And for anyone who may not be aware, October 25th, Monday.
Yes, Monday.
Vaccine verification comes into play. I had an opportunity to speak with both King County Executive Dow Constantine and City of Seattle Mayor Jenny Durkin last Monday. And there was a press briefer, and we tried to give people information about this, because the other part about, these mandates and verifications is not everybody gets the news about what's taking place. So let's start with that. What has been taking place at Seattle Parks and Rec over the last few months? How has that changed? How has it evolved? Obviously, I assume you're going to start the same way everybody else starts when I ask about this, is we shut down and tried to figure this out. Give me
we did it. Seattle Parks and Rec, we've been going strong, and actually the use of our parks has actually gone through the roof with COVID. More people have been outside, been engaging in our parks and our programs because
you did not
the only option, right?
Sorry, Justin, you did not initially shut down. You did not initially, when it was like, okay, business is shut down, the Parks and Rec, y'all stayed open.
Yeah,
I remember some places
have been going,
okay.
But our community centers, we took I believe it's been a long time, but I believe we took like maybe a pause for a week, but we provided childcare. And then we immediately pivoted, and at the end of March started providing 24 hours a day, 7 days a week shelter for people experiencing homelessness, trying to de-intensify some of the shelters to prevent people experiencing homelessness from contracting COVID in a more constricted shelter environment. So we launched 3 shelters, one at Miller, one at Garfield, and then another at the Southwest Teen Life Center to support youth. And those shelters operated for 5 months continually, and were supported by Seattle Parks and Rec staff, along with shelter providers and nonprofits that we partnered with at Compass and at YouthCare. So, we've been going strong, and then we started providing childcare shortly thereafter, recognizing that, essential workers needed to have a safe place for their children to be. And so we provided childcare Monday through Friday, and we also offered additional Wi-Fi and internet support for youth and teens who needed access to the internet. So our world really changed when COVID when we went into lockdown, but we persevered, and the team really has risen to the occasion time and time again, and continue to provide that exceptional service you talked about at the beginning, to really serve communities, center our neighbors, center those farthest from recreation access and recreation justice, and also those farthest from education justice, recognizing that not everybody has access to internet at home. And so it's our job, when we have access at community centers, to provide that to community and help facilitate access by providing a safe place for people. So that was our goal.
What was that like for you? It had to be again similar like everybody. Well, everything is shutting down, and then this term came up that we're familiar with now that nobody really thought of before, called essential workers. And then suddenly you had to realize, well, wait a minute, we can't stop. whatever's happening with the holes in this safety net right now, some of this is falling in our laps.
Yeah. I had colleagues across the country that lost jobs because their community didn't understand the essentiality of recreation services and parks and recreation services. And so the city of Houston laid off a number of parks and recreation professionals. But here in Seattle, we thought about what do we need to do to respond. And thankfully, we were able to identify a niche that we could provide, and all of the permanent Seattle Parks and Recreation employees were able to maintain employment throughout the pandemic. Late in 2020, we did have to lay off our temporary and some of our seasonal staff. And unfortunately, we've been experiencing the consequences of that choice because we've really struggled to bring back employees. And I know other people have probably talked to you on this show just about the challenge that they're having hiring staff. And right now we're struggling to hire guest service clerks and our recreation attendants, lifeguards, people working in our childcare programs. And so we're offering hiring bonuses through our partner, the Associated Recreation Council, to people who are interested in working in childcare. And it's been hard, but we're persevering and we're continuing to serve our neighbors.
You're listening to Rainier Avenue Radio .world. I don't know what happened right there, but okay, I guess this is part of COVID. You're listening to Rainier Avenue Radio .world. It's me, Tony B. My guest is Justin Cutler from Seattle Parks and Rec. And another reason that we're here is because of vaccine verification. So, this has become a political football. Getting vaccinated, not wanting to get vaccinated, where you can go. So here we are now on Monday, and tell us what will happen and at which facilities what will happen, and maybe if there are parks where nothing will change. Justin, this is why I brought you on. Tell us what's going to happen on Monday.
Well, fortunately, at our parks, nothing is changing at our parks. It's only in our recreation facilities and all indoor rental facilities. So all community centers, all pools, community center public shower programs, Amy Yee Tennis Center, Volunteer Park Conservancy, environmental learning centers, and all indoor facilities owned by Seattle Parks and Recreation. So like Pritchard Beach Community Room and all those different indoor places you'll be required to show proof of vaccination or proof of a negative COVID test in the last 72 hours to access services. This is part of an attempt to continue to support health and well-being in our community and ensuring that when people are accessing public spaces that they know that they're safe and that they're protected from the COVID-19 virus. So all indoor spaces within Seattle Parks and Recreation, you'll be required to show proof of vaccine or negative COVID test.
And Justin, I get it. Okay, I get it. But there are two sides, maybe three. Who knows in this case how many sides there are, but I get what you're saying. Yeah. But that leads to some questions. And these things often, for Black people, for immigrants, for people of color, end up highlighting disparities and systemic oppressions that exist. You say they don't exist. I'll be happy to take that, but that exists. So let's start with this. It puts somebody apparently in the position of having to check and verify and validate. Verification, is that like a security guard at the door of these facilities? How's that going to work?
Yeah. So all of our staff at our community centers, their job is to enforce our rules and kind of our standards for basketball, for rental guests, for all sorts of different activities. And so our team is in a position constantly to have to enforce rules related to how to operate and navigate our community center. So that's nothing new to them. What is new is checking a medical document or checking kind of this documentation. And I think we recognize that is going to put our staff in a difficult place where they're going to have to review somebody's vaccination status or review their testing status. And we've worked hard to give them as much tools and resources as we can. And I know that even on Monday, we're going to come up short because it's going to feel awkward. Nobody wants to be put in this position where they're having to do that, but we also know that this is a pandemic and it's a real critical point in the pandemic. And so I know our team's ready to do this, and they're excited to be able to provide a safe place for community. And so it's going to be hard. I'm not going to deny that, but I know that our team will again rise to the occasion and do a great job, and they'll do it with compassion too. These individuals, they work day in and day out serving our community, and they do an exceptional job, and they really try and center neighbor well-being and do it with kindness. So I know they'll do a great job.
So if
you, I think to your point
go ahead.
Well, I would like to speak to your point, you made about just oppression and how oftentimes these policies are racialized and people of color experience a greater rate of impact, right? And I think that we have talked about that these last couple of days about what is this going to mean for teens who are trying to access our teen services, because they fall into that category of 12 and older. And unfortunately, we don't have a very good answer. But one of the things that we are doing is looking at bringing back some more of our virtual programming and thinking about ways, as your previous guest from YouthCare was talking about, how can we be creative to use the tools and the experiences that we gain through virtual programs to really stay connected to our young people, even with this mandate in place for those individuals whose parents may not support them in being vaccinated or have concerns due to racial oppression related to medical care in the past. So I think those are things that we recognize, and we're working to figure out ways that we can support young people specifically through this mandate.
What have you done, if anything, or whatever, to let those who attend the facilities on a regular basis know that if you're over 12, you're going to have to have vaccine verification? And you mentioned some of the challenges that they may have with acquiring this verification. What have you done to alert them, to alert the community? Again, because part of the problem is getting information to everybody. And so, as we know, the people who are usually needing the service the most are the ones who are getting the information last. How have you, what have you done to get the word out to folks?
Yeah, so this week and last week, we've been working with our team to communicate to the different neighbors that have been coming to our sites. We posted signs earlier this week letting people know that the vaccine mandate is going to be in effect. King County and the Seattle Times and other news outlets have also been, broadcasting that the mandate is coming, that this is going to happen. Unfortunately, a lot of the messaging has been focused on bars and restaurants, but this also impacts sporting events and different activities that many of us take for granted at this point. But beginning Monday, there'll be more stricter guidance, and this mandate will be in effect. And you'll have to show proof of vaccination or negative COVID test. So, this isn't just a Seattle Parks and Recreation mandate. This is a county-wide mandate for certain types of facilities. So our hope on some level is that as this normalizes on some level, that people will understand that this is expected, right? And that when you go to a public place, that you need to be prepared to either show a negative test or show vaccination status. Now, I think when we think about it, right, those who choose not to be vaccinated may be disproportionately impacted because the rate at which you'll have to stay kind of tested will be higher because you'll have to stay up with that 72 hours. And, we recognize that might be a barrier for some people. And so we're trying to identify other ways that we can work with partners that have rapid testing or antigen testing to make sure that we either that people know where to get tested so that they can stay current, or we can have testing on site when we have a larger or some type of special event. So those are some of the things that we're doing to mitigate the impact. But you're right. It's only been a couple of weeks that this has really been in the news sphere, if you will. And we recognize that, and we're just going to have to keep messaging this.
And Justin, if you know anything about Rainier Avenue Radio, we advocate on behalf of our community. That's why we exist. And so when you say the Seattle Times and whoever else you mentioned, that's cool. But we have independent Black media in this country that our communities rely on. So as soon as I saw the press release, I was like, whoa, we gotta, not everybody's getting this
Yeah.
information in this message.
Yeah.
And I do appreciate that fact that y'all responded pretty quickly on short notice and came on to share this information. But, I'll just say that when getting the word out, don't forget that there's Converge Media, there's the South Seattle
Yeah,
Emerald,
South Seattle
a lot of
Emerald,
other alternative things that if you're trying to get the word out to the people who use your facility, then the word should be getting out in addition to those major media through. That's just my little, and you can comment on that if you want to. But
I totally agree, Tony, and I'm happy to come on your show anytime to talk about parks and recreation services and get the word out. So,
I appreciate that, and I see that I'm just talking about being proactive instead of me being reactive. To say, hey, we need to hear about this. So the other part of it, because we're almost out of time, and again, this is how we do on this show. It's just the other thing about this is for your employees. Because we've heard about people who've been employees at restaurants who are getting punched, who are getting spat on, who are experiencing violence. What about the safety of your employees when this mandate hits on Monday? What have you done? Because people have brothers, sisters, fathers, mothers that work at this facility, at these facilities.
Yeah, and we've had people attacked at our facilities as well. We've had people chased down with scissors, physically beaten at one of our shower sites recently, and safety is a big concern of ours. And so we've provided training on how to manage aggressive behaviors and how to deal with people being aggressive. And we've worked with our security team and worked on helping to support staff just with training. But beyond that, we've also thought about staffing ratios and making sure that we have ample staffing at our community centers so that staff aren't alone or feel alone in that environment, recognizing that oftentimes when there's two or more together, that helps support the safety of the team as well. So those are some things that we've done, but unfortunately, there's still going to be incidences that occur. I wish I could protect all staff from violence that occurs in our community, but we can't, and we'll continue to do the best we can and provide training and provide support. But I think it's a bigger issue related to just where people are at, what the stress that people are experiencing, and how people are choosing to respond to where we're at in the pandemic.
Again, the world is just what it is. So if folks who are Black or again in marginalized communities are receiving and taking the vaccine less, that also means that proportionally these very same people who need and use your facility are going to be hampered more because of the vaccine verification. You argue with that if you want to, but it just is what we have. Communities that are less vaccinated. These are the communities that are more likely to want to utilize your essential services. How are you going? Are you just going to tell people no, you can't? It's the rule.
Yeah, I mean, this is a policy choice that we've made as the governor of the county and the city to require vaccines for entry and/or negative tests. So that's what we've signed up for as community, and that's what we'll be moving forward with as Seattle Parks and Recreation for our indoor facilities.
Justin,
I think the other. Go ahead. No, go ahead.
No, go ahead. Go ahead.
I was just going to say, I think the other thing that we can do and that we are working on is just what are alternative methods of continuing to engage people. And I think we've learned throughout the pandemic that there's many different forms that we can stay connected to community, from virtual programs to outdoor recreation activities that may not require vaccination status. So we'll continue to provide those services throughout the pandemic, thinking of how can we provide alternative experiences. And also, we've worked with Black, Indigenous, and people of color nonprofits to fund over $300,000 worth of programs, both at our community centers and at other sites, recognizing that sometimes coming to our community centers is a barrier for people. And so we've been really intentional about reaching out to community and providing alternative ways for people to access our services and also provide resources, because we recognize that not everybody may feel comfortable coming to a community center or can come to a community center. So we want to be proactive in reaching out and reaching in.
A place to be in, Justin.
It is.
Again, you're listening to Rainier Avenue Radio.world. It's me, Tony B, hosting our special Impacts of the Coronavirus on Seattle and surrounding communities program that we do every Friday from 1 to 3, have been doing since March 13th. And projections, there are businesses and other institutions that are planning out for coronavirus out to 2025. And it might even be longer than that. My guest again is Justin Cutler. Justin is Recreation Division Director for Seattle Parks and Recreation. Justice, I want to give you a minute here or so for final words that you'd like to share with our audiences.
Yeah, I think while we have the time, I'd just like to express my deep appreciation to the team at Seattle Parks and Recreation. You know, really, it's the recreation and parks professionals that show up every day that make our parks and keep them green and clean, and support access to community services, community centers, pools, parks, and playgrounds. And the team does an amazing job. And really, it's without the team that we wouldn't have these exceptional services and these opportunities for community to learn and grow and recreate. So really, I just want to give a big shout out to the Seattle Parks and Recreation staff and to the community that relies on us for services as well. Thank you to trusting us with your children and with your older adults and coming to our events and activities. Just thank you.
Well, again, Justin, you know, I got to ask you the questions that I think our community wants the answers to, but I do want to also emphasize that I called you guys and basically said, hey, this thing just happened. Can you get somebody on the air for me? And y'all made it happen. And so I appreciate that. Justin, thanks for joining me here on Rainier Avenue Radio.
Yeah, thank you so much, Tony. Really appreciate your time.
Again, you've been listening to Rainier Avenue Radio special edition of the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B. Earlier in the program, I was joined by KeAndre Magee, a member of our community who many of you know, played sports and now is coaching and teaching at O'Day High School. And he was sharing his COVID experience, and he contracted coronavirus early in the game. Erica Lamone was also here from the prior to that, Dr. Talbot Mullet joining us, and we talked about basically the health of our youth. And during this pandemic, we know that there are also physical elements, although they may be, again, less impacting our youth. They are still impacted, and we know that mentally, but physically too. What's going on with our youth? And Dr. Mullet, who's a pediatrician, came on and shared that information. Then we talked to Erica Lamone from YouthCare, and just kind of continued on this thing with the what's going on in our community centers, kind of a youth-based show. Even in DeAndre's telling us his story, one of the saddest things for him was that he couldn't hug his kids for 7 weeks. So yeah, we'll be back next week. We may be doing this through 2025. However, right now, that's it. That's all the time that I have. That's going to do it for the kid. I want to remind everybody that we will be broadcasting the Rainier Beach Seattle Prep game at 4 o'clock on Saturday in the rain. If they're going to play in the rain, we'll broadcast in the rain. We'll be there for you. It's the last regular game of the season. And until we talk again, remember, whether you believe you can or whether you believe you cannot, you are probably right. I'm out. Peace.